Welcome back. We're focusing on health matters this morning. I'm joined in studio by Xolani Gwala to talk to us about his journey with cancer, and also in studio is Health Minister Dr. Aaron Motsoaledi. Dr. Motsoaledi, thank you so much for joining us.
Thank you, and good morning, Xolani.
Good morning, Minister.
So earlier on, we were talking to Xolani about his journey with cancer, and one has to admit, I mean, he was in private healthcare, which made things a little bit easier for him. But we do know that in South Africa, when it comes to public health care for people with cancer, some of them die waiting for help. What is the situation looking like in South Africa where that is concerned?
Well, it's not only South Africa, by the way. Cancer has exploded on our faces globally. You know, as part of the explosion of non-communicable disease, you'll remember that in 2011, the United Nations called a special meeting, high-level meeting of heads of states to come and discuss non-communicable disease, including cancer. They repeated it again in 2014, and then again last week, a week before last in New York, during the United Nations General Assembly. Heads of states again debated this issue of non-communicable disease. So it's a global phenomenon, but yes, you are right. Cancer is one of the biggest killers now in South Africa. And that's why, if you listen to the President's State of the Nation address, he mentioned that we need to launch a cancer campaign reminiscent to the HIV/AIDS campaign that we have launched. You are aware that the HIV/AIDS campaign is one of the biggest movements on health anywhere in the world, and the South Africa's movement is perhaps the biggest. So he was saying, using the same example, we might have to launch a cancer campaign. And we are busy planning it. The plan was to launch it sometime this month or maybe next month. I'm not sure how far the team is, because there's a special ministerial advisory committee on cancer that consists of experts, it consists of survivors and activists. They've been working with the department towards the launch of such a movement.
Dr. Motsoaledi, you say cancer has exploded in our faces, but this is not something that is new. What plans are in place? When we take a look at KwaZulu-Natal, as well as the Northwest, those are the most affected areas when it comes to public health care and a lack of oncologists. Are we being reactionary instead of proactive about this?
Well, we are proactive, but there are situations that went bad, like KwaZulu-Natal, and these are bad examples. We are proactive because one of the things that any country needs to do in order to recognize and plan very well is to have information. In other words, to have the numbers like we're having in HIV/AIDS. Cancer was not like that. A cancer registry was launched in 1986. You can imagine how many years ago it was, but it was not compulsory. It was not compulsory. People were just doing it sporadically. But in 2011, I passed regulations that makes cancer registration compulsory. But we had a backlog, and internationally, there's a 5-year backlog. That means a backlog on statistics. Yes, we have now reduced, in South Africa, we have reduced that backlog to 4 years, which means we have statistics up to 2014 only. For the past 4 years, is still a gap, and the cancer registry is still doing that, because we only started recently in 2011 to start gathering that information in a way that is compulsory. So in comparison, we'll say we're doing relatively well. Then we can plan. Now you are aware that last month, or rather in August, the National Parliament passed a new law called NAPISA, National Public Health Institute of South Africa, where now we're taking the whole issue of cancer, motor vehicle accidents, non-communicable disease, we put them under one roof. You sort of do total surveillance and epidemiological studies so that we have got information at our fingertips. The problem at the moment is that the information is not on our fingertips. That's why we'll look to be reacting to events.
Xolani, the minister talks about information and it being at the fingertips. To your own admission, before this came to your doorstep, you didn't also know about it.
No.
What are we doing to educate, to sort of bring people up to speed with what we are talking about when we talk about cancer, that it's not just something that is far-fetched?
Look, I hear what the minister is saying, that the South African government is doing its best, but we've got to do much better.
Yeah, it's not enough.
We have got to do much better because clearly, particularly black communities, I mean, cancer has not been spoken about, one, but secondly, we've had that stigma. And I agree that what we need to do is to do to cancer what this country did to HIV and AIDS, and we've got to have that kind of program. It is a problem. For instance, I come from Mbendle, which is a rural town in KZN. If I had cancer in Mbendle, I probably would have died because there wouldn't have been any other place where to go.
Sure.
I know that Durban has maybe Nkosi Albert Lutuli where I could, but it's like, what, 100 k's away or 120 k's away? How do you know what I mean? So if you are in certain parts of this country and you have cancer, forget it. Forget it. So we need to expand treatment and make it available for people in far-flung areas. Not only treatment, but also information, as you say, that people must understand what cancer is. And that, you know, there is a possibility of fighting it.
Right, we do have a caller on the line. Let's just take Surya Patel from Johannesburg. Surya, your question or comment to Mr. Xolani Gwala or the Health Minister? Hello, Surya, are you there? Your comment or question to Mr. Xolani Gwala, the Health Minister? It seems we're having connection problems with Surya. They will try.
But can I
sure.
jot in on this question of mental? I think we must also understand the real facts. Even though we are going to launch a cancer campaign reminiscent to the HIV/AIDS campaign in terms of information, you're not going to get cancer treatment in Bentley. Xolani, unfortunately. You can only refer. Cancer is very, very highly specialized. It needs only certain centers. There are certain centers, and the centers is usually hospitals attached to medical schools because it needs researchers, it needs professors, and as you say, we've got very few oncologists. So we work by referring. For instance, when you go to Steve Biko, at the oncology center, you'll get the bus full of patients from Mpumalanga because Mpumalanga does not have any center whatsoever, simply because they don't have a medical school. Same as Limpopo, same as Northern Cape, same as Northwest. Now, KZN has got centers in Addington, in Nkosi Albert Lutuli, but also in Grace Hospital in Pietermaritzburg. Gauteng has got centers especially for radiation oncology. Centers in Charlotte Maxeke and Steve Biko only. Free State has got only university. So I'm just saying, do remember that we are dealing with a disease.
No.
Whereas HIV/AIDS, after being diagnosed, we have trained 23,000 nurses around the whole country, where with what you call nurse-initiated ARV management, where a nurse can diagnose you and treat you without any doctor. There are 23,000 such nurses in the country. You cannot do so with cancer. Yes.
It sounds as if we know what the problems are, right? We do need these centers. In terms of priority, are we prioritizing that? Let's talk about the department's budget, because you do get a budget. Are you putting enough money into cancer treatment, especially in public hospitals?
Yes, we are. We are trying, but the resources are far outstripped by the demand at the present moment, I must state. But I'm just saying, for now, to areas like Mbendle, as he's saying, I'm not going to promise that there will be a possibility of getting a nurse to treat you because cancer is treated by highly trained specialists. It's not an ordinary person who can
Which is sad, Minister, because essentially what it means is that people from Mbendle are condemned.
No, they are not. They are not. They are referral patterns. If you are condemning us on having no referral patterns, then I'll agree. They can see at Mbendle, unfortunately, they'll see very late as always because people
that's the problem.
They can see that this is something we can't deal with. It's likely to be cancer, maybe even do a biopsy that they can do and send it to a laboratory. When the results come, they found that this is cancer, then they refer you. So I'm not saying they condemn you. I'm just saying they can't treat you there at Mbendle. It's not going to be possible. I'll be lying to you if I promise that all the rural hospitals, especially district hospitals, because it doesn't happen in many places.
We'll expand on that in just a moment, if you will. Let's take Ike Motsepe in Alberton. Ike, your comment or question? Hello, Ike. Your comment or question for Xolani Gwala, the Health Minister, Dr. Aaron Motsoaledi. Right, gremlins in our system this morning. They just won't let us be. Okay, Xolani, you were about to...
So the other thing is, and Minister, which is what we need to look at, is that because of what's happening in the public sector, the private sector is extremely expensive. My treatment is just, I mean, I can't even say it. And the reality is that unless you can afford that kind of money,
then you are condemned.
Because if I were to go to, and this is what I was saying earlier on, that I went to Reicha Park, and what the community was saying to me there was that the problem is you've got Charlotte McGregor, which is better, oncology department is all right, but everyone comes there. So the queue is so long that for me, I would have had to wait maybe 3-4 months for that emergency surgery that I had. And what happens in the 3-4 months? You die.
Xolani, you are wrong when you say because of what's happening in public sector, the private sector is expensive. They are just expensive on their own. And I've been fighting that battle as far back as 2009, if you remember. And people were attacking me for that when I said private healthcare is exorbitant, it's unfair. People said I wanted to kill private healthcare. I said, no, I just want people to have access because they've got facilities, they've got both human, by the way, both human and financial, so they need to open up. And you are aware that I approached the Competition Commission to do a public market inquiry on the price of private healthcare. And Judge Ngobo was happy that, the former Chief Justice, and he has released a report which proved what I was saying. And one of the recommendations is that we need to regulate the prices. Now, that report coincided with the 2 bills I've released, the National Health Insurance Bill and the Medical Aids the Amendment Bill, both of which are going to try and solve this problem. So it's not about the problems in the public sector that the private sector is expensive. It's expensive on its own. And during the hearings, even the World Health Organization from Geneva and the OECD came in and confirmed that this is very expensive. You've got to take down your prices. So at the moment, we are sort of negotiating with pharmaceutical companies about prices. For instance, one of our best-known negotiations is to make sure that in the next 10 to 15 years, the rate of cervical cancer, which is #2 killer of women, is no more by a vaccine, because we are lucky there's a vaccine. And you are aware that we started implementing that vaccination of 9-year-old school girls in schools in 2014. That's not being reactive, it's being proactive. And that vaccine was costing 730 rand per dose, and you need 2 doses. And I went to the company and said, but we're going to give you 500,000 school girls. So you have got no business to charge people this much. And the price was dropped to 139. Sure. Now that's just by negotiation. So and what we are going to do? Mean that
Motsoaledi, and while it's great and while it's commendable, we still have to be honest about where we are as a country in terms of the public healthcare system and cancer. We are losing the battle. Perhaps it's time we admit we do need help, and where should that help come from?
Of course we do. We do. I mean, why do you say we must be realistic as if we know? The reason that we asked the president to put it in the State of the Nation was indeed realization
it's one
that
thing
we are
to
in trouble here.
It's one thing to have all these amazing articles in terms of strides that have been made. But for the daily people, there are people who wake up at 3 a.m. that Motsoaledi to go and queue.
No, but I know.
Only to get turned away. And
I know that too, but if you check one of the things we are doing, that's why I'm saying is when we say the private sector is expensive, it's not forced by the public sector to be expensive. They are expensive on their own. Firstly, you make sure that you use all facilities, which are in both public and private. That's what the NHI is saying, because these are country facilities. Sure. You mustn't talk like they are in 2 different countries. Minister. So one of the things we are going to do, which we have already done for KZN, is to contract oncologists in the private sector, because there are many. to see patients in the public sector. For instance, in the KZN at the moment, they are seeing 450 patients per month to try and clear that backlog. So when we launch the cancer campaign, we are going to make sure that we contract whoever is an oncologist to deal with the problem.
No, look, it's understandable, and I hear what you're saying, that the private sector is expensive on its own. But, you know, it's a demand and supply issue. The reason why they are expensive is because they know we have no option. If we had an option, if I could go to Edendale Hospital in Maritzburg and get their assistance, they wouldn't be charging me this much.
I'm really asking you, Xolani, please, with due respect, to go and read the report from the judge, because those things are explained there. The health market doesn't work in the way you are defining. It's not, health is not any other commodity.
It shouldn't.
That's why it's not, and it can't be. So it does not follow the rules you are saying about demands and all that. They are just expensive on their own. And I'm arguing, and we have argued with figures, that the more people you treat, the cheaper it should be. It's not the other way around. If you put more people on treatment, then it should be cheaper. It should not be expensive. Part of the reason why private healthcare is so expensive, because they've opened up for few people and they need to make money from very few people rather than from many. And I gave you an example of a company which was selling an HPV vaccine for $730 because it was only where you go as an individual to go and buy. But I told them that we are now starting a program, which is a country program, a government program, where we vaccinate every 9-year-old school girl, and that's about 500,000 of them.
We'll
then you negotiate with the company and you show them. If you treat 500,000 girls...
We do need to take a short break, but we'll come back with more on that. We just need to sort out a few issues. We take a short break. We're back again with Xolani and Health Minister Dr. Aaron Motsoaledi on cancer.